queer body worker and community weaver. My work is primarily as a community body worker. So what that means is that within my private practice, I offer like sliding scale body work and support mostly for queer and trans community and BIPOC community. I specifically specialize in scar healing, like post-top surgery and other gender-affirming surgeries. And then within my community organizing, I coordinate multiple community healing spaces so folks can access care for low cost, sometimes free, always sliding scale within a collective community setting. Yeah, so I guess the main crux of my work is trying to fill the gap in the lack of gender-affirming healthcare, especially pre and post-op for trans and non-binary and queer communities. And it's not specifically just around kind of like surgery, but also like there's many different intersecting kind of healthcare issues that I think our communities face. And on top of that, there's like a lack of practitioners that are able to support them and provide affirming, safer spaces for them to receive that support. So that's the main kind of, gap I'm trying to fill, especially within Quebec, where it's really hard to access healthcare, where especially if you're like non-status, refugee, migrant, you also may not have access to healthcare. Folks living with like multiple disabilities. And then on top of that, a lot of the kind of particularly post-op support that folks need isn't covered by RAMQ or insurance through a project called the Trans Care Clinic, where we have like an integrative care model where we have multiple practitioners that offer different modalities that support folks, whether it's acupuncture, lymphatic drainage, scar tissue work, massage therapy, energy healing, in order to kind of really give that kind of wrap around support that folks need. And it's completely like by donation, and the practitioners are there like, you know, donating their time in the spirit of mutual aid. And at the same time trying to provide like a kind of, I guess in a way, like a pilot model of what this kind of care could look like and should look like and what we should be seeing more. It kind of feels like there's been this amazing ripple effect where, I mean, first of all, a lot of folks don't know what kind of support is available to them holistically after surgery, or completely new to bodywork in general, whether it's even just a relaxation massage. So I feel like there's been like a real culture shift of people accessing that kind of care and like viewing it as something that is healthcare and not just a luxury. Definitely like folks who've come as clients to the Trans Care Clinic who then end up working in or for different like queer-led organizations have ended up writing grants, or we've co-written grants with them, or they've allocated their program budget to like host more of these types of like community care days that center queer and trans healing. And so yeah, being able to like see that bloom over the last couple of years and kind of get more out there just beyond the one clinic that we have, to me is like everything, yeah. My first introduction to mutual aid work, I don't know, I feel like it's just always been there. I grew up working class, like second generation migrant in London. I also grew up in a religious context, so I think it's just always been kind of interwoven into, yeah, all facets of life just through those lived experiences of how people show up for each other, support each other. I would say that I've got the most involved maybe in a more sort of like directive way during university, working in like food waste projects and redistributing food waste and setting up like community cafes for like housed and unhoused people to kind of like be in community together at the same time. And then also around that time was the refugee crisis exploding in Europe, so I went over there a couple of times to set up community kitchens. Yeah, mutual aid has definitely supported me. I mean, it's supported me in running like different projects. It's supported me when I've needed help. Right now, it's really helping me be able to offer like lower cost sessions to folks who really need it, because there's a community member that donates to me every year. and that means I can like sustain my income and also support folks at the same time. So I'm really grateful for that. I think it's important to talk about the stories of mutual aid and grassroots organizing and collective care, because I think so much of it is invisibilized. A lot of it is unseen. I think we have like, you know, a big kind of like social media, celebrity activist culture, which I think individualizes like a lot of leadership, and kind of, I feel like takes away from that kind of like lateral, non-hierarchical like networks that are actually like what makes movements and community. And yeah, I also feel that a lot of that kind of invisibilized labor is often gendered and racialized. Like folks who've been like, you know, socialized as women are often at the forefront. Queer and trans folks, definitely like racialized folks, yeah, often don't get seen. So I think being able to really like feel into and connect to like, yeah, how so many people are like holding everything up when the world is crumbling, I think is really important, because it can be demoralizing otherwise. What are the kind of like conditions that enable us to be able to show up better and more when we're less burdened by things like high rent, so rent control, universal basic income, like actual functioning healthcare, like access to free public spaces or low-cost community spaces where we can actually gather, host things, would all make a large difference. Folks who have like access to like generational wealth, having a political education so they actually redistribute it and invest it in more ethical ways. And I think also just kind of maintaining this like culture around the importance of, yeah, caring for each other on this collective level. I can't remember who else kind of said this. I feel like it might have been Paulo Freire, but there's something about like this idea of building the road as you walk it. And I think that's something that queer communities have always done and have always needed to do. And mutual aid to me is about like creating these reciprocal networks of care like that transcend like time and space, because it's not the same as a transactional mode of care or charity. It's not like I'm going to do this for you right now and you're going to return this to me tomorrow. Like that's not how it works. It's about trusting that that energy of care like goes into the collective web. Yeah, there's just like a really deep sense of trust within that, and I think that is the world that we should be building together.